Hey, it's Mo Egger. You've heard me talk about Long Neck Sports Grill for a while. There's no better place to hang out during the summertime than the Long Neck's patio. They've got Northern Kentucky's best wings, an awesome beer selection, 4K TVs. It's a great place. But have you ever thought how cool it would be to have a Long Neck's in your neighborhood? Well, your chance is here. Check out the franchise opportunities by going to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often. We do this every Wednesday. We talk injuries with one of the experts from OrthoCincy. OrthoCincy has specialists and locations all over the tri-state, and they also offer walk-in orthopedic urgent care during the week from 9 a.m. to 9 p.m. and on Saturdays, 9 a.m. to 1 p.m. You can learn more at OrthoCincy.com, OrthoCincy.com. Dr. Adam Metzler from OrthoCincy is with us. We got some sobering news over the weekend. Hunter Greene goes on the injured list. Now, the Reds are insisting this is precautionary. We don't think this is going to be anything that we really have to fret that much about, but it's the staff ace. It's a guy who's had Tommy John surgery before. It's an elbow issue, and he is one of the faces of this franchise. So let me start with this. They've done an MRI. He's going to get a second opinion, but when they review the MRI with Hunter Greene, what sort of stuff are they looking for?
Yeah, I mean, looking at the elbow there, he's had that previous injury and issue and surgery to that arm. And so referencing that area, he'd be looking to make sure the previous ligament that they used to reconstruct the ulnar collateral ligament, also known as the Tommy John ligament in layman's terms, really just looking to make sure that's intact. And so there might sometimes be some inflammation, which is seen on MRI as well. But the big key of that MRI is looking to make sure that the actual ligament reconstruction that was performed at the time of surgery is fully intact.
So he's going to get a second opinion. Let me ask you about that. Is that commonplace when we're talking about athletes with the profile of a guy like Hunter Greene?
I think many professional athletes get multiple opinions anymore. It is very standard to get different opinions from different surgeons with different experiences. So even at the college level, it's not uncommon anymore. It's really much more common in the professional circuit.
So they've done the MRI, and then there are the next steps. Should the next steps, out of maybe an abundance of precaution, be to just shut him down for the year?
Well, it seems like with the current pathway that the team's on, there wouldn't be a lot of reason to continue to throw your stud pitcher until something worse happens, pending that MRI is relatively benign in nature. I don't see a huge reason to push your stud pitcher into a situation that would put them into making their 2025 campaign more vulnerable, but that's my independent discretion or decision.
Yeah, no, I think you and I are on the same page. So if we're dealing with something here that's maybe on the little bit more benign level, but is still significant, yet it's not going to get to the level of Tommy John surgery, what sort of possibilities are we dealing with?
Well, if hopefully it's just inflamed, and maybe they can work on some small mechanics and get them on some anti-inflammatory medications and some rehabilitative protocols that get things strengthen around the elbow and shoulder to reduce the mechanical torque on that area. Hopefully the symptoms resolve, and sometimes that can take weeks, sometimes it can take months. And so that would be the best case scenario for his situation.
He obviously has had Tommy John surgery before. Does having that in his history make him more susceptible to elbow injuries?
Absolutely. Anytime you've had any surgery to any joint, your risk of injury or further injury is increased.
I want to ask you about Jeimer Canderlio, who has been placed on the injured list with a big toe fracture. They've called it the great toe. I'll call it the big toe. For something like this, is there any treatment beyond rest?
Well, yes, there is, but most of the time it is non-surgical intervention. The big toe, we call it the great toe for whatever reason in the orthopedic literature, but that toe, if it does go into the joint, and so if it involves the cartilage or the joint, that can be something that needs surgery because we don't want that joint to kind of fall apart and separate, and that can cause early arthritis. That'd really be, one of the only major indications for surgical intervention, or if it's significantly angled one way or the other or dislocated. But many times these are indirect hit injuries, and they'll have subtle kind of hairline fractures, if you will, and they can heal uneventfully in a boot and protective weight bearing and protected from being hit. And when you do a lot of running, it does slow that healing process down, so they have to lower the impact type of activities that they're doing until they start to see healing. And on X-ray, as well as the athlete feels more comfortable.
We had last week, Dr. Adam Metzler from OrthoCincy is with us. We had last week during the same joint practice, 2 Bengals get carted off with patellar tendon tears. Both Deontay Smith and Chris Evans out for the season with this injury. Can you start with the patella tendon and tell me what it is and what it does?
So it's a vital structure to our knee. It connects the kneecap, your patella, down to the tibia, the shin bone, and allows you to straighten your leg out. And so it's vital for everything every athlete needs to do, which is cut and pivot and do squats and push athletes away. And whether you're a big guy in the trenches or a skilled player making cuts in the backfield, you need your patella tendon. And when it ruptures, you need surgery. And it's a pretty long rehab and pretty significant recovery for these guys, but it's always a surgical problem.
So we've got a lineman and we've got a pretty diminutive running back. Does the recovery and the rehab differ based on, one guy being much, much bigger and playing a different position than the other?
Well, what I tell my patients is biology is biology. I need to get a tendon to heal to a bone. And whether you're a running back or an offensive lineman, you need biology. You need it to heal. So our job as a surgeon is to reattach your patella tendon back to its home location, typically the patella. And then your job is to follow the protocols. And these protocols, as I say, are not Adam Metzler's protocols. These are national protocols set in stone. And it's a tough, slow rehab. They're locked in full extension for walking for 6 weeks. And they do start early rehab for swelling control and very limited range of motion when seated. And we typically advance that motion slowly to hopefully by 3 months we have full motion. But you got to get the tendon to heal to the bone, and bone likes to heal. Bone heals pretty quick. Tendon to bone healing is a much slower process. And so that's why these rehab protocols are much slower than, if you break your collarbone, we put a plate on it, and by 3 months, you're usually back playing a sport, maybe even earlier. For the tendon like this, you're looking at 9 to 12 months for a high-level skilled athlete to return back to the field at their previous level of function, pending everything goes well with rehab and recovery. Whether that surgery is done here in Cincinnati or in San Francisco, those protocols are there, they're in place. And this is a big rehab. It takes a long time to get your muscles reactivated around that joint as well.
Yeah, really unfortunate, the 2 injuries occurring minutes within each other. I appreciate the expertise and your time as always, Dr. Metzler. Thanks so much.
No, have a great day.
I'll try. Dr. Adam Metzler from OrthoCincy. I say this every single week. The great thing about the people at OrthoCincy is they have specialists and locations across the tri-state. This includes walk-in orthopedic urgent care weekdays 9 a.m. to 9 p.m. and on Saturdays 9 a.m. to 1 p.m. at both Edgewood and Anderson. It is easier and cheaper than going to an ER when you have an urgent orthopedic injury. Go to OrthoCincy.com. That's OrthoCincy.com. Hey, it's Mo Egger. There's no better place to hang out during the summertime than any one of the 3 Long Necks locations in northern Kentucky. Wilder, Hebron, and Richwood, an awesome outdoor patio, a great menu, northern Kentucky's best wings, and an amazing beer selection. But have you ever thought about how cool it would be to have a Long Necks in your neighborhood? Well, your chance is here. Check out the franchise opportunities at longnecksportsgrillfranchise.com. Longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often.